Okay, just think for a second. If you needed, say, a routine dental checkup, how fast could you actually get one? Or, if there was a real emergency, how far is the nearest ER? For a lot of us, those answers might already be a bit worrying. But for one group, a really important one that often gets overlooked, these questions point to something much more systemic, a real erosion of healthcare access. Welcome to the deep dive. Today, we're really going to dig into this critical issue, how healthcare access for autistic adolescents and young adults is being, well, systematically worn away, especially with all the economic and policy pressures right now. We're basing this discussion on a recent study. It's Zhang et al., published just this year, 2025. The title is Pilot Rural-Urban Comparison of Healthcare Experiences Among Autistic Adolescents and Young Adults. And we're also looking at it through the lens of a really insightful piece by Jaime Hoerricks, a PhD, called No Roads, No Rights, No Care, Autistic Futures Under Austerity. That one adds some personal perspective and broader commentary. So this Zhang study, on the surface, it looks pretty focused, right? 180 autistic teens and young adults surveyed about healthcare, rural versus urban, across the U.S. Sounds, contained. But Hoerricks, the author of our other source, argues the findings are anything but minor. They call it a small flare and a long night. So what did this flare actually light up?
Yeah, it really lit up some pretty significant disparities.
Yeah.
Truly significant. The study found, for instance, that autistic youth in rural areas had way more trouble getting care. A huge number, 57.1%, said there just weren't any providers nearby. None. And even when they could find someone, 40.5% said those providers didn't really have adequate autism-specific knowledge.
Wow.
Right. And then there's a dental issue. Even with insurance, they really struggled to find dentists who'd accept it. So these numbers, they're not just showing a gap. It's more like systemic abandonment. If you're autistic in a rural area, healthcare can be functionally out of reach, whether you have insurance or not.
Okay, so that's the rural picture. What about urban areas?
Well, urban participants did a bit better on provider availability, which you might expect, but interestingly, they were more likely to not have dental insurance at all. Different barrier, same outcome in some ways.
Okay.
And across both groups, there were these common themes, right? Things like delayed or totally disrupted transitions to adult care, big gaps in continuity, and this feeling, this chronic sense of being dismissed because, as Hoerricks puts it, the system just couldn't find their needs legible. It wasn't set up to understand them, let alone invest in understanding them.
That's a really stark picture.
Yeah.
So the study shows these problems, but Hoerricks pushes further, saying it's not just a gap. What's the more unsettling idea they're putting forward?
Right. Hoerricks argues this isn't just, a hole in the system we need to patch. They're saying it's more like a blueprint. It's not accidental neglect. It's a design that's just becoming clearer and clearer.
A design.
Yeah. The idea is that the Zhang study basically captured a snapshot, a baseline, or maybe a soft warning before even more policy changes kicked in. Things like big funding cuts for Medicaid services that got relabeled as optional. These cuts started shrinking provider networks even faster. So the implication is pretty rough.
Sure.
Something that seemed maybe improbable before, like an autistic person living without any real functional medical support, that could actually become the standard situation, the design playing out.
But yeah, that's unsettling. Not a gap, a design. And it connects to this idea Hoerricks raises that care is shifting. Less of a public service, less of a right, and more like a subscription model. Like you pay for the chance of getting help, but there's no guarantee. They share this personal story, even with good dental insurance. Getting a simple checkup for their family meant a 4-month wait. 4 months, just for routine stuff, assuming nothing goes wrong in the meantime.
Yeah.
How does that story, plus the studies data, show this subscription idea hitting autistic people?
Well, that 4-month wait story, it really clicks with the study's numbers, doesn't it? You got the rural youth who can't find dentists even though they have insurance.
Right.
And then the urban youth who might have more dentists around but often lack the insurance to actually see them. It shows how dental care specifically becomes functionally optional for many.
And you're saying this isn't just happening by chance.
Exactly. Hoerricks points out that recent federal budget decisions explicitly reclassified things like dental care, speech therapy, AAC devices, augmentative and alternative communication, which is absolutely vital for many autistic people.
Crucial, yeah.
And even in-home support, all reclassified as optional under Medicaid, which means, as Hoerricks puts it, they're vulnerable to deletion the moment there's a budget crisis. Which, let's be honest, feels like always.
So calling them optional basically puts them on the chopping block.
Pretty much. It means critical supports can just vanish.
That's Yeah, that's chilling. Service is just deemed optional.
Yeah.
Which then leads to an even tougher question, I think. If care is a subscription, and some services are optional, it feels like there's this element of conditional worth. What does Hoerricks mean when they talk about this system not just withholding care, but actively sorting people, deciding who's useful enough to get it?
Yeah, sorting is a key idea here, and it gets in some really insidious logic, according to Hoerricks. For rural autistic youth, especially those with complex needs, they often become sort of invisible. They don't fit that, PR-friendly face of autism, the quirky genius trope that sometimes attracts funding. They're living in the margins, and those margins are getting squeezed.
Okay.
Then in urban areas, the sorting happens differently, often through insurance status, which Hoerricks argues acts like a stand-in for how the system views someone's independence potential or, academic promise.
So it's based on how close you are to fitting in.
Essentially, yeah. The system measures worth by how close someone is to normative expectations. Can you hold a job, go to college, regulate your emotions in a way that doesn't disrupt the status quo? When someone's needs are complex or they communicate differently or they don't conform, those optional supports become, as Hoerricks says, a knife edge.
A knife edge? How so?
Well, think about a child who needs an AAC device to communicate effectively. If that's deemed optional and denied, that's devastating. Or consider a meltdown, which might stem from sensory overload or communication breakdown. If that's treated simply as bad behavior or even criminality instead of a sign of unmet need, you see how sharp that edge is?
Yeah, I do.
Hoerricks frames this really starkly. They call it a soft eugenics of omission.
Wow, that's strong language.
It is. It suggests this quiet, systemic process where the lack of appropriate training for providers, the lack of autism-informed settings, it all effectively ensures that people who don't fit this narrow, compliant mold just get overlooked or excluded. It connects to this idea that care is offered based on institutional comfort, not on actual vulnerability.
Institutional comfort, meaning what makes the system feel okay.
Exactly. And when that comfort gets disrupted by complexity, by difference, the system's response is often reduction or removal. Budget cuts aren't just trimming services. Hoerricks says they're shrinking the circle of who is imagined to deserve care.
That's a really provocative idea. Healthcare access as a reflection of economic decay. For a lot of people, I think those feel like separate things. So how does Hoerricks specifically connect economic policy to whether or not someone can actually get health care? How is healthcare a ledger of economic decay or a metric of collapse?
Well, Hoerricks argues that rural areas aren't just sort of under-resourced passively. They're being actively hollowed out. Strip mined of infrastructure is the phrase used because they no longer serve the primary needs of capital investment. They become sacrifice zones.
Sacrifice zones, okay.
And then urban areas, even though they might look like they have more access on paper, Hoerricks describes them as a shell, hollowed out by things like gig contracts for doctors, insurance claims being denied left and right, impossible deductibles, insane wait lists. You might technically have access, but it's not functional.
So it looks like it's there, but it's not really.
Exactly. The argument is that the current form of capitalism is great at extracting premiums, taking your money, but delivering minimal actual service in return. Healthcare becomes just another transaction. And in that transaction, autistic people, especially those with high support needs who might require more complex or ongoing care, they just get priced out by default. The system isn't just failing them, it's evolving in a way that makes supporting them unprofitable and therefore unlikely.
Okay, so if healthcare access is this kind of ledger of economic decay and services are being hollowed out, that leads to the next logical question, right? Even if we could somehow find the money to rebuild clinics or make dental care accessible again, who would actually work there? Who staffs these places?
That's another critical layer. Hoerricks points to the provider pipeline itself. They argue that policies affecting student loans have made medical and dental education incredibly expensive, prohibitively so for many.
Right, the debt load is enormous.
Exactly. Which effectively gates access for working class folks who might otherwise want to go into medicine. And it potentially steers those who do make it through away from serving poorer or rural communities. Why take on massive debt to work in a system with low reimbursement and fewer resources?
Makes sense, sadly.
And then you compound that with immigration policy. Hoerricks points out that many doctors and dentists, especially in underserved areas, are immigrants. Yet policies are tightening, creating this reliance on the very people who are sometimes being criminalized by the rhetoric or by policy changes.
That's a grim paradox.
It really is. Hoerricks calls it a death spiral masquerading as reform. It's like the silent alignment of different policies, education debt, healthcare funding, immigration, that quietly makes healthcare just vanish for certain populations and places. So when you look back at that Zhang study, even though its scope was limited, like it didn't explicitly break down the data by race or gender identity or specifically for AAC users, the larger picture it hints at is undeniable. As Hoerricks says, the data is always already behind the reality. It points to this accelerating collapse of support systems for autistic people.
Which means, I guess, it falls on us to ask those harder questions. Not just, what program can we create, but more like, who is this system actually built to exclude? Whose absence is just assumed, maybe even desired, in how things are structured? Hoerricks is really clear. This isn't about fixing leaks in a boat. It's about realizing maybe the ship was never meant to carry us in the first place. But importantly, this isn't presented as a point of despair. It's framed more as a call for refusal, for what Hoerricks calls revolutionary optimism. This idea of doing the hard, maybe messy work of building lifeboats while the empire lets the whole sink.
Yeah, and there's this really striking anecdote Hoerricks shares to illustrate that. Years ago, they met a Sambo coach, that's a martial art from Kazakhstan. And this coach, he also happened to be the village dentist.
Wow, okay.
So when Hoerricks chipped a tooth, the coach just handed them a few abrasive strips and showed them how to smooth the edge themselves. And the point Hoerricks draws is profound. Care doesn't have to mean credential. It can mean skill, yes, but also generosity, trust, and knowledge passed from hand to hand. It points directly towards mutual aid, community care, not just as nice ideas, but as essential survival practices.
So the message is sort of, if the official systems fail, we adapt, we create our own. If the roads are gone, make new paths. If clinics close, teach each other what we know. If the dentist disappears from the map, maybe we learn basic skills like how to file our own teeth.
Exactly. It points towards building support networks, disability justice frameworks, autistic-led initiatives that don't rely on the state or these collapsing systems.
Which leaves us, and you listening, with a really powerful final thought to wrestle with. If we genuinely can't afford the world they've built for us, if the systems aren't designed for us anyway, maybe it's time we stop trying so hard to live in it. Maybe it's time we start building our own.